Hello, good morning to everybody. Here is Dr.S.K.Ballav, ex-professor and head of the Department of ENT and Principal, Khulna Medical College, Khulna. I like to discuss something about inflammatory disease of the tonsil, which is most common disease of the tonsil, and undergraduate students should know in details about the chronic inflammatory disease of the tonsil. Before going to discussion in detail, I like to discuss something about the gross anatomy of the tonsils and situation of the tonsils. You all know that there are 5 tonsils in the oropharynx and nasopharynx. Among the 5 tonsils, 4 are situated in the oropharynx and 1 is in the nasopharynx. The palatine tonsil, lingual tonsils, they are situated in the oropharynx, and nasopharyngeal tonsil situated in the nasopharynx. The palatine tonsil is the most important one, which is situated in between the anterior and posterior pillars of the oropharynx. The palatine tonsil has got 2 poles, upper pole and lower pole, and 2 surface, medial surface and lateral surface. The lateral surface is covered by incomplete capsule, and the medial surface is containing 12 to 15 openings, among which the biggest one is situated near the upper pole and is known as crypta magna. Whenever there is chronic inflammation in the tonsils, there is accumulation of inspissated pus inside the tonsillar crypts. Before going for diagnosis of chronic inflammatory disease, that means chronic tonsillitis, we have to know the cardinal signs of the chronic tonsillitis. What are the signs? The first one is flushing of the anterior pillar. Size of the tonsil may be enlarged or atrophied. There may be inspissated pus inside the tonsillar crypts. You can see the inspissated pus by pressing over the anterior pillar gently. And palpable non-tender lymph node in the neck, which is known as the tonsillar lymph node, situated half inch below and behind the angle of the mandible. Whenever these 4 cardinal signs are present in any patient presenting to you with chronic inflammation of the tonsil, then the diagnosis is chronic tonsillitis. The treatment option for chronic tonsillitis is tonsillectomy. Before going for tonsillectomy, you have to do some routine investigations for fitness of the general anesthesia. There are so many methods of tonsillectomy operation, among which the commonest method practiced all over the world is dissection method. Nowadays, there are so many advanced technology to do tonsillectomy. As for example, you can do the tonsillectomy by laser, you can do the tonsillectomy by harmonic scalpel, you can do the tonsillectomy by bipolar electrocutter dissection as well as by coblation also. There are certain definite indications for tonsillectomy. These indications are chronic tonsillitis, recurrent acute attack of tonsillitis, 3 to 4 attacks per year for consecutive 3 to 4 years, second attack of peritonsillar abscess, obstructive tonsils causing obstruction to airway as well as foodway, and whenever the tonsil acts as carrier for Streptococcus beta hemolyticus and tubercle bacilli. There are certain contraindications also for doing tonsillectomy. Among those, most important one is the acute infections and other contraindications for any other operations under general anesthesia. In the past, epidemics of poliomyelitis was one of the most important contraindication, but nowadays in Bangladesh, poliomyelitis has been declared eradicated. That's why it is not so much important. Today, I think this small and short discussion may help the undergraduate students who are preparing themselves to sit for the final prop MBBS examination. Thank you all.